P2P and daily mobility, folks. We're going to get into more hip work actually today. So we're going through full hip circles and then closed chain hip circles. So last time we worked on getting into a retraining position as defined by how much internal versus external rotation can we get, and where does that degrees of motion show more restriction one versus the other. And so we're going to still stick with that retraining position today. Let's do a quick assessment. And so range of motion in a squat position today. So we're just going to settle down into a squat and kind of get a general feel for how much tension you have in the knees, the hips, back maybe, and how far down you're getting. And then we'll reassess after we do our movement drills. So really quick too, this is a great quote by Dr. Carrick from the Carrick Institute. He's big in the neuroscience world, so functional neurology in the neuroscience world, super smart guy. So he's talking gait here, and so gait is the most important biomarker for neurological integrity. And so we've been talking about gait and just another kind of confirmation that it's really important. We're going to get into, again, that retraining position, and then we're going to kind of bring the hip through all four different positions that we worked on last time: a cross body, a front, a side, and then a back. I'm going to try to create a little bit more space here, and so we're just taking that hip through a nice full circle, fighting for that retraining position all the way through, tall posture, breathing. Remember to lengthen the spine and then come back around the other way. Good, let's switch sides. And you could reassess after that if you wanted to on the squat. I'm just going to take that second side through. Again, tall posture, balancing tension and relaxation. You got this. And back around the other way. You do the range of motion that works well for you. It doesn't have to be identical to what I'm doing. It might be less, might be more. And good. Let's kind of shake that out. Those are some work going through that full range of motion. Let's try a couple squats again. So my depth is a little bit better. I'd say that's a good drill for me. And again, you could take your journal and just jot down if that was a really good drill for you. Come back, practice those, use them in your warm-up. Anytime that the hips are feeling kind of tight and you want to get them loose, get them warmed up. Then closed chain hip circles. These are amazing. So love using them in a warm-up, especially any type of running, sprinting, jumping, cutting, or going for like a walk or a hike. And so the closed chain hip circle, we're going to go out into a lunge position first. And I'm in a forward lunge, tall posture. I'm going to gently press right below the gluteus musculature. So glute med, glute max, almost kind of like you're cupping your bottom. So you're going to hang on to the buttocks, drive forward a little bit. So with that hand, we're going to press forward. That's going to create a little bit of opening in the joint capsule, or a little bit more space in the front of that joint capsule in the hip. From there, you can maybe drive forward a little bit more if you need to. If you already got a stretch, just hang out here. And then we're going to circle, focusing on that back hip. So that circle that we're trying to create is through that back hip. Sometimes we'll actually also get an improvement in range of motion if we stop focusing on the hip. But I want, just from a teaching standpoint, for you to know that this is the joint in question, or the one that we're working on first. But then if we take an external focus of attention, think about actually, like, let's say I was wearing a pant leg and thinking about pushing the seam of my pants around in a circle out here. Sometimes that will actually deepen the range of motion if we can focus more externally. You could also have somebody like hold a tennis ball out here, or give you an external object to drive your knee towards, and you might notice that that improves your range of motion. If so, a great tool to use. Let's go to the other one. So forward lunge again, gently press in towards the top of the femur there. That's where the hand is. Again, right underneath the glutes. We're driving forward a little bit with that back hand, so I'm trying to actively kind of push forward. Again, that back hip is the one that we're working on. A fairly straight leg is what we want here. And then again, you could go external cueing or external focus if that was helpful on the other side. Really nice, you guys. Whew. That's the forward lunge version of a closed chain hip circle. Go ahead and squat. Reassess your motion. For me, that's definitely a good one. Kind of already knew that because I've done them before, but if it worked for you, journal it. Then we're going to go to a side lunge position. A little different, still a closed chain hip circle, just a different stance. And this is going to highlight more of the inner thigh or the adductors. So we're going to press, again, top of the femur. A little bit of pelvic tuck can be helpful here. And again, as you gently press in with the hand, that's going to help mobilize the joint capsule. And we're creating that circular motion. Should feel a little stretch in the inner thigh. And then we can again take that focus away from the stretch in the hip here and say, hey, let's push the knee out, work on that knee circle that's actually kind of driving the hip circle, but focusing externally again. And see what that does for your range of motion. And for me, definitely getting deeper into the position. So good to have an external focus. So maybe if you do have an object close by, you don't have a partner, so I could use an object like the cubbies here. I'm going to drive again, top of the femur, a little pressure in. This should be gentle pressure, it doesn't have to be much. And then getting into the hip circle, start to feel out the movement pattern. And then I'm going to go external focus again. And that allows me to settle deeper into it. Nice. So you can shake that out and then go ahead and reassess. So we'll want to do gait again after this one. And your squat pattern. So feeling pretty good in the squat. And then check your gait and see if that was a good drill for you. If it was, I hope it was. And again, keep that training journal. Keep practicing your daily mobility, you guys. And look forward to seeing you in the next video. Thanks.